Last week, one incident showed the futility of gun control laws and, at the same time, the necessity of firearms in the hands of law-abiding people at certain times, under certain conditions, during certain occasions. Here's what happened. At Mercy Fitzgerald Hospital in Darby, Pennsylvania, near Philadelphia, a mental patient who had a criminal record entered a hospital which was supposedly gun-free with a gun, shot and killed a health worker. At that point, a psychiatrist went to his desk and got his gun, even though he was in this gun-free zone, and engaged in a gun battle with the criminal gunman. The physician, the psychiatrist, was able to prevent the criminal from being able to pursue or to continue his pursuit of a shooting rampage. Police later said that the doctor, because he had a gun, was able to save probably countless numbers of lives because he had the gun, knew how to use it, and did use it. What this shows is that gun laws, in this case a gun-free zone law, had no effect whatsoever on the criminal misuse of firearms or the criminal use of firearms. Fortunately, the doctor had the sense not to obey this stupid law, and he had the gun, which enabled him to stop the criminal and to save himself and probably a lot of other people. This shows that gun laws in and of themselves are useless in fighting crime. Criminals simply don't obey them. It shows also that sometimes law-abiding people, in order to protect themselves and others, simply have to disobey the laws in this particular regard. What this brings up is another question, and that is whether or not the public in general is going to have to resort to massive civil disobedience against these laws and other laws which deprive them of their rights and which render the safety of society suspect or non-existent. The public, I think, is generally getting fed up with these nonsensical laws. And the question now is whether or not the public in general will resort to massive civil disobedience against stupid gun laws.